So let's see here. Let me pull up our disclaimer. So thank you for joining the Cancer Conversations on Choices podcast. We are here to provide general information, and the purpose is to provide you with the information and education. It's not to substitute any practice of medicine, nursing, or other professional healthcare services, including giving medical advice, and there's no doctor healthcare professional relationship, patient relationship that's going to be formed. The use of this information on the podcast or material linked from the podcast is at the user's risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition that may have or should seek the assistance of their healthcare professionals for any such condition. If you have any action or inaction as a result of any of the content that you consume on Cancer Conversations and Choices podcast, this is based solely on your decision, and the Cancer Conversations and Choices podcast cannot be held liable for any of the consequences of such actions or inactions. Please consult a doctor or other healthcare professional if you have any concerns regarding your health. Always seek advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition. If you think you have a medical emergency, call your physician or provider and go to the emergency department or call 911 immediately. So we got our disclaimer out of the way. I am going to continue working on this tech part of it while you guys don't mind starting the conversation.
Okay.
We'll see if I can figure this out.
Okay, that works. So today's topic that we're going to be discussing is mastectomy, right? Is that the right thing to do, or what other choices do you have? And
myths, facts, and choices.
Yeah, myths, facts, and choices. We're gonna touch our own, stories was it. And because Deborah and I both went through mastectomy, Deborah did like a double, right? Bilateral?
No.
Just to say, you're also
single.
Single. Okay. So I'm Simon. I'm holistic cancer coach, and I was diagnosed with breast cancer stage 3B in late 2008. And entire 2009, I was going through the treatment of surgery, mastectomy, which it was right side. And it was a full mastectomy and then chemotherapy, radiation, and reconstructive surgery for that. And I will probably talk a little bit from my personal experience, what have I experienced by going through mastectomy and how difficult it was. And then Deborah probably will pick up and tell her story, and then we're going to continue from there, right? So in 2009, I had a mastectomy in the right-hand side. After that, I went through chemotherapy, and then I had to go through reconstructive surgeries. And to match my left breast, I needed to go through expanders, like expanding my skin to match to my right breast. And that period of expanding my skin was very, very painful and very harsh, because every 2 weeks, I believe, so if I remember right, every 2 weeks I would have to go and I had a silicone implant, and they had to inject the silicone implant with saline water so they could expand the tissue, my skin and the tissue around it, so to match the size, and then to put like a permanent implant, silicone implant. So that every 2 weeks I would have to go through a very painful procedure. The procedure itself wasn't painful. They would just inject the fluid, but the afterwards were very painful. It was like it seems like my entire skin was like stretched to the point that I couldn't even take a small breath in, because it was like pressing on the ribs and other parts, and God forbid if I had to sneeze or cough, that was like a torture. So that lasted about, I would say, about 3 to 4 months. And then after that, I had a permanent implant, which had its own ups and downs up until people who decide to go through mastectomy and reconstructive surgeries, they have to do their own research and learn more about it before they would decide to do so. Because no one ever spoke to me about it. It was just presented to me that after the mastectomy, we'll do reconstructive surgery, and that's it. And no one would ever discuss the steps, complications, and discomfort the woman has to go through by having mastectomy. Or mastectomies, both breasts. So we're not talking about cosmetic surgery here today. We're talking about people who choose to go with mastectomies by just having either gene mutation, which is BRCA1 and 2, and people who got diagnosed with cancer. So this is entirely talk about that people who get in that side, not cosmetic at all. So because cosmetic is done differently, not close to what we get. So anyhow, the whole thing was like, number one, my whole entire right side, on the back and the front, and my half of my arm, it was completely numb, and it was numb for years. It wasn't just numb for a day or two or months or two. It was years. I still have that numbness. It's been since 2009. It's been 15 years. There's still numbness in my. I just probably got used to it at this point. But and then beyond that, there was some lymph nodes removed from my I had 22 lymph nodes were removed. So because of that, I have been like dealing with edema on this right hand. And another tissue like fluid retention here under my armpit that I got after implant. It's still there, that always bothers me when I walk, especially in the summertime, that I have to always cover that area so my arm won't, touch or taper on it. And it's just like very uncomfortable. So it's been 15 years. I still feel discomfort from mastectomy that I choose to do and no one ever talked to me. And that there might be some discomfort in your life, and you might experience this for the rest of your life. And the other thing was psychological part of it. When you're a young woman and you have no breast, to me, it sounded that I lost part of me. Like I was like, I did not feel a complete woman when I had mastectomy. So it was very embarrassing even to talk about it. It was very embarrassing, to change clothes or put the swimming suit on or anything like that, because like I did not feel that what my body shape was like all like, symmetrical that it used to be before. And it took me years to overcome that stage of discomfort and talking about it, or even undressing in front of people, or even my loved ones, like my family. Changing my clothes in front of them. It was like I would always have to hide. I didn't want people to see, because entire implant, it did not have it turned out not to, so the implant did not turn out the same size as my other breast. And it's very different, and it's very scarred, and it's not good looking, let's say it this way. So it's not a pleasant looking, and it was like hard for me to look at the mirror myself, yet alone to undress or change the clothes in front of my sisters or my daughter, or it's like very embarrassing. It takes me, like, if we go on vacation in the winter time, if we did go on vacation, for example, and I had to choose a swimsuit, so I would go probably through probably 200 different swimsuits to be able to choose one that would, like, I would feel like a bit more comfortable and confident that I'm wearing a swimsuit. So those are probably, I would say, again, I always think of it, I'm grateful being alive. Those discomforts, I still think, okay, those are just my mindset, I gotta change them, but it tags you along the way. It's still there, it's still sitting. I mean, it wasn't there. It's been like only some years that I got comfortable talking about it and showing the and showing my breast that what I went through. It's more of a now like bringing awareness to people than being kind of, sitting in that, like being afraid or being shy or being uncomfortable to talk about it. So that's my story. And the second part of the story is by removing the breast did not prevent the cancer from coming back. That's another big myth that we're talking about, because when they talk about, okay, let's remove your breast and we're going to get rid of cancer. No, it's not, because underlying cause of the cancer, it still sits in your body. And that's what happened to me. So 5 years later, cancer came back with recurrence into the other organ. And at that time, I realized that just removing a breast wasn't a solution to my healing process. So I needed to look at more deeper into my own body and realize what exactly created cancer and how can I, myself to do some work and help my body to heal. So I'm going to stop right here, I think, and we're just going to continue with it. If Deborah would like to take it from here.
Hi, everybody. My name's Deborah. I don't have a little tag on mine, but I am a holistic cancer coach with beatcancer.org and also an FNLP, which is a functional nutrition lifestyle practitioner. And Marinette, are you with us? Are you fully with us now? I just want to make sure. So,
Yeah, no, I still
okay.
am. I'm still trying to figure out, for some reason, I think it's the same thing that happened the other night with Zach when he was trying to go live on his. I'm having to log right back in and do everything. So I'm
Oh, okay. Okay. Yeah. So, breast cancer, that's quite when you get diagnosed, it kind of threw me for a loop, but not really. I mean, I guess I kind of half expected it to a certain degree, only because my grandmother had breast cancer, and I just thought, oh, it's probably just a matter of time. And my mother died of cancer, but not breast cancer. So I just kind of thought, oh, okay, I've got 20 good years left. Well, you know, 3 years later of that thinking, and I'm like, oh no, I guess maybe not. So it was just kind of a big surprise for me, and I was diagnosed with invasive lobular breast cancer in the left breast. And me, I am, every year I would go have mammograms every year, just because knowing that my grandmother had breast cancer. So I would go every year, have mammograms, and had been doing that. I've been doing that for the last 15 or so years, if not longer, probably longer. And so once I was diagnosed with that, you go through, the biopsy phase. You have the mammogram, and then you go in and you have the MRI done, and then they want you to go in. Well, now we're going to do a biopsy, and had biopsy done, and then that's where you find out that you have, the type of cancer that they're going to be dealing with, and what that looks like. I fortunately was stage 1A, but I did have a tumor. So so that was kind of a surprise for me, because I didn't know. And the week before, or actually 2 weeks before, I had already had a full physical, and didn't no one found it. I didn't find it. Well, it's in my body, and I didn't even find it. So go figure. So I guess I can't really blame that on anybody and on anybody either. It's just one of those things. And so invasive lobular breast cancer, left breast. And there are many different types of mastectomies that you can have. I thought for sure once I got that diagnosis, I had went, I transferred hospitals and went to the best. This is what they do all the time. But I thought, well, I'll just take them both off. Why not? Why deal with it? I'll just, have them both removed. This was my thinking. And I'll be honest, I was really pleased to hear that my surgical oncologist said, no, absolutely not. Why do that? You don't need to. It's not there. You don't have to. Went through a lot of genetic testing. And of course, after you get the diagnosis, they did a lot of genetic testing. You get your onco score, that type of thing. So they base a lot of things on, this is my experience, by the way. So they based a lot of whether I was going to have a mastectomy or a lumpectomy at that point, just based on the onco score out of 100. Mine was an 8, very low. My genetic history, they said absolutely no, it's not genetic. It's just kind of one of those fluke things. You just happen to get it. Yeah. Well, okay. So I just happened to get it. One of the things that I was talked about then too is I basically talked out of having of them both, having a double mastectomy, which I'm glad. I was actually glad about that, and I thought, you know what, let's just deal with the one, and if it comes back after I do everything that I can, then we'll deal with that also. So I went with the one, and the types of mastectomies that are out there are there's a simple mastectomy, modified radical mastectomy. There's radical mastectomy, silicone sparing, or I'm sorry, skin sparing mastectomy, nipple sparing mastectomy. I mean, there's all kinds. I mean, it's almost, as I was doing some research as well on this, it's almost like you could have a catalog.
Right.
You still
That
in your
is so true.
store in a
Yeah.
sense, right? It's like, oh, we could do these, and these. Well, what I ended up having to do was actually having a full mastectomy. If I were to do it, I couldn't do a lumpectomy because after I went back and they did another, after they did the second, actually a third scan, believe it or not, it was a third scan, they just noted some faint shading on some of the tissue because mine is tissue related. So they're like, you know what, we're going to take the whole thing. That's what they said was the best thing to do. Okay, I do that. I did not have to have radiation and I did not have to have chemotherapy. So like, okay, so that's what I went with. So I basically had a simple mastectomy in conjunction with, and they call this an alternative one, and oncoplastic uh, surgery, which is where I just went ahead and automatically had reconstructive surgery at the same time. So not only did I have, it was about a 7.5 hour surgery, go in, surgical oncologist does the mastectomy, which is basically you're removing all the breast tissue. And there are several different types, again, of mastectomies. And then depending on the extent of the tissue and the individual needs, depends on what you're going to, what they need to do. And so I had all the breast tissue removed, did not impact the chest wall muscle. So that was be able to remain intact. So because of that, I had plastic surgeon already standing by. Once she was done, he stepped in and did the expander, like Maya was just talking about, did the expander and had that surgery all done in one fell swoop. Coming out of the surgery, it was amazing. You think you'd have to be, I thought, oh, I'm going to be in there for a week. Oh, no, it's an outpatient procedure, which just kind of blew my mind a little bit. I'm like, oh, I get to come home the same day. So, a part of me thought, wow, okay, so maybe it's not as bad. And then I thought, they do this too much. This is like going to a drive-through. So, I mean, just kind of like looking at it so many different ways. And I thought, okay, well, that's good. Yeah, why do I really need to stay in there?
Right.
So I was able to come home. I actually stayed at a hotel. We didn't drive home. It's like it's to kind of stay close just in case. I don't know why. And I was so tired, I didn't really want to move. So we did that. And that was beneficial for me to stay at a hotel that once I coming out of surgery and stuff. And then the next day we went home. And of course, you're all bandaged up and you've got drains, little funky drains coming out of you and stuff that you need to watch and measure and whatnot. But my in doing in some of the research that you'll find, they'll say anywhere from 3 to 4 weeks or 3 to 6 weeks for recovery for a mastectomy. I don't think so. I kind of don't think so. I mean, I think for me it was seemed to be just like I'd say about 4 to 6 weeks. You start feeling a little bit better, where you can move around more, and that kind of thing. But with that, what they don't tell you is those expanders. Yeah, no joke. That is
Right.
painful. To me, that was probably the most painful
Right.
part to a certain degree because and you don't feel everything. So they're like, oh, we're gonna have to, we'll just inject you. It's just like a flap, it's almost skin sparing. So where they just have the flap and they just find it's kind of funny with the expander, there's a magnet in there. So they know exactly where to inject you at. And they inject you and it just slowly fills up that breast if you're going to have an implant. So that's what I did. So that's why you're going to have the expander. So I should probably expound on that. That's what I did. Right. As an is for, after the mastectomy, your options that you can have. There's a lot of different things that you can do. I suppose we're going to talk about that in a little bit as well. But I opted for an implant, and yeah, it was that, and then also I had what's called I wanted it's not a they use part of the fat from the stomach and to contour and to fill in some places. And I should mention before that I had implants before. I had implants for 12, 13 years prior to being diagnosed with breast cancer. And so when I was diagnosed, I still had implants in. Well, obviously with the, the diagnosis that I had, well, I'm obviously one's being gone is going to be removed. So I'm like, well, they said, well, we can leave that one and match the other one. I said, absolutely not. Let's just take them both out, because it just so happened that I was thinking about, I don't think I want these anymore. Kind of burdensome, kind of cumbersome. I just think I just want to be more natural with everything that I had been studying and going through, and in my life, it was one of the things that I wanted to do was let's just take them out. So it was amazing. I had an incredible doctor, but I too had some issues with the expander the first time. I felt like a sarcoma had developed underneath my left armpit up there, so a little bit higher. And it felt like, honestly, it felt like I had a tennis ball stuck underneath my arm. I'm like, well, that doesn't seem right. And I thought, well, is everything shifting? Am I gonna be listening to the left a little bit more because of this? I don't know. So went back to the doctor and said, hey, what is happening here? And they said, yeah, it looks like there's this. Well, let's watch it. Well, you can't proceed on, or at least my plastic surgeon said, no, we're not going to proceed on. We need to know what this is and what's going on. I actually had to have another surgery because it was not going down. The drains were not working. And so I ended up having another surgery. And he redid everything, and it still wouldn't go away. And so I had to go to interventional radiology, and they actually put another different type of drain in. I said, well, while you're in there, why not just drain the thing? You're there and you find it. He said, absolutely, that's what we're going to do. And that was the ticket. And I felt like $1 million after that. And we just watched it, and I've kept more drains and everything. So probably about 3.5 to 4 months, I had drains in and dealing with all of that. You learn how to live with that.
Yeah.
And then, it after that, it worked. That worked for me. And I haven't had an issue with it developing or filling up with fluid now, as far as movement and having some pain and stiffness. I think that's always going to be there because they did take lymph nodes as well.
Yeah, unfortunately. That's a part. For people who would decide to, go for mastectomy and do reconstructive surgery, you have to get all the insights from your physician and doctor if they know what they're talking about. I don't think so male doctors would ever experience what the female goes through when their breast gets removed and the pain they have. I think for the doctors, it's like a normal thing that the patient will experience just pains and discomforts, but living every day for months with the discomfort and pain, that's a one thing. And the only people who experience that could talk about it. And the biggest reason that we actually want to talk about everything here, when you get diagnosed with cancer, your brain kind of in this hurry mode, like, I gotta do everything fast, because that's what the doctor tells you, like, you gotta move fast because, or the cancer is gonna spread outside and we would have to do more and more. So,
and Maya, you're talking about that decision from diagnosis to whether you need to have a mastectomy and what type and
right.
and that type of thing, correct? Okay.
Right, yeah. So it's like a little, you have like a week or two to make that decision, basically based on your doctor. And nowadays, the cases of mastectomy increased by a lot. And people who have a small lump in their breast, they've been offered a mastectomy where, where they can just have a lumpectomy or have just a part of the breast removed, instead of going for whole mastectomy. In the worst case scenario, when doctors tell people, like, okay, their oncologists tell people, you can even have a double mastectomy just to prevent the reoccurrence. Okay, and we are here, like, I'm sitting here to talk about, like, by removing your organ, a tissue is not preventing people from cancer coming back, because it did not happen to me. The cancer, the breast is a tissue. the problem is cancer. The cancer is still in the body because something had caused that cancer. And it wasn't the tissue that had caused cancer. Removing a tissue doesn't mean like you're going to get rid of cancer. And my next biggest thing, like always, like I would like really touch this part when people get diagnosed with gene mutation, BRCA1 or 2. Their doctor would suggest them to have a double mastectomy to have a prevention of cancer. So based on our research, based on my research, the more than 92% of cancer are not genetic, are not related to genetic mutation. The cancer related more to your metabolic stage, your chronic inflammation, lifestyle, diet, and stress, and many other factors like endocrine disruptors, toxic exposures. This is what the cancer is all about. It's not because of the genetic mutation. So I was trying to find the research what it says. There was a research done that people who have BRCA1 or 2 positive, and if they go for breast implant, that lowers their chance to be diagnosed with cancer. I was trying to find that research and I couldn't find it because the research was based on opinion and theories. Prior to that, stating that if you remove your breast, you're gonna have a less risk of getting cancer. Because more than 50% of people who carry BRCA gene never get diagnosed with cancer. So what percentage of people, because I was trying to look on some sites that it was stating that up to 90% of people are going to be safe from getting breast cancer. So it seems like basically people who have BRCA gene mutation, 90% of them, if they remove their breast, won't get cancer. And I was trying to find that study and I couldn't find anywhere that study, like where that came from overall, just because the removing of the breast, and it says it's based on observation. That observation did not include any, it did not show any lifestyle, any region or, so many things involved in that picture. It's not just a genetic mutation itself, and so doing this research, I couldn't see that. So I was asking myself, okay, they're saying it's 90% of people are not going to get cancer in their life because they remove their breast. And then the question is, how many of those people that they assume would get breast cancer? Because as we know, more than 50% of people would never develop cancer, even though if they're carrying BRCA gene. So that did not kind of, put the math, I couldn't calculate that. If more than 50% of people with BRCA gene, they won't get cancer in their life ever. So how did they come up with a number that 90% of women would be prevented from cancer if they remove their breast, if they're carrying BRCA gene? Do you understand what I'm saying? So, and then BRCA1 and 2 gene is not only related to cancer. People could develop ovarian cancer, people could develop lung cancer, people could develop colon cancer. So maybe as a prevention, we should remove like half of our body not to get cancer. Remove the colon, remove the ovaries, remove everything. Why breast? Why breast? But the males could develop, prostate cancer, but I don't see males having a surgery as a prevention, removing their prostate just because they have a BRCA1 and 2 gene mutation. Why female? Why breast? Because my bottom line that I came to this conclusion, it's making money for people. It's making money for the system because removing a breast requires reconstructive surgeries, and reconstructive surgeries brings more because those reconstructive surgery, you got to go every 10 years to change your implant, and that's all, the system of money making. So people who have a BRCA gene mutation, they have to look more in depth, like number one, why do they carry that gene? What is there? They might carry from their parents, yes, fine, but if their parents never had the cancer, why they think they're gonna develop? And they have to look more into the, you know, deeper picture in there. Just by removing an organ, their breast, that doesn't mean the BRCA would not cause other cancers in their body if they're carrying a genetic mutation, right? So that could cause colon cancer down the road. That could cause ovarian cancer down the road in the males, prostate cancer, colon cancer, lung cancer, pancreatic cancer. That's another one that related to BRCA gene mutation. I mean, not related. I would say like people who might have a BRCA gene mutation and develop prostate cancer. So not prostate, pancreatic cancer. That's another one. So like my question still is, what percentage of women being prevented from breast cancer by removing their organs, just preventing themselves from not developing a breast cancer? That's what my biggest question is, and I could not find any research or any data. And people who decide to go for double mastectomy just because they have a BRCA1 or 2 gene mutation, they have to do their research in depth.
Were you wondering about the life expectancy if they were to have
life expectancy, not developing cancer, just because they have a genetic mutation. And based on
I did.
You did, yeah.
I did find some, and I thought it was interesting.
Okay.
The life expectancy of a person who has a mastectomy, and I thought, okay, it piqued my curiosity because number one, what are you basing that off of? Truly, I mean, because I personally I don't do life expectancies. You know, you
because no one knows, right? No one
knows, right?
No one knows.
No one knows.
Because life expectancy could depend on so many things.
Absolutely, exactly. Right? So many things. So this is what this one was, and this is the resource for this one is healthgrades.com. And it said for a lumpectomy with radiation. Now, this is a lumpectomy. This is just going in and taking the tumor out and some, the tissue around it. So once it's clear, then you take that out. And with some radiation. 83.2% 10-year survival rate.
Yeah.
Just that doesn't say anything about it. That one had radiation. Doesn't say anything else about chemo or, having any, to taking any aromatase inhibitors or, a tamoxifen or anything like that. Those types of things. It didn't say anything about that. So I'm taking it as face value. It's like, okay, if I have this is my thing.
Right.
A single mastectomy is 79.9% 10-year survival. A double mastectomy is 81.2% 10-year survival rate. That was all I said.
Yeah. It's like, again,
I just thought it was interesting. I thought that was really interesting.
Yeah, that is interesting. And again, based on what? That's like, that's because survival rate depends on so many different things. Like, if any of us are familiar with the work of D'Agostino, Professor Thomas Seyfried, and other, professors like Otto Warburg, the cancer is a metabolic disease. It's not a genetic disease. Very few cancers are genetic disease, but the most of the cancers are metabolic disease. So when we talk about survival rate, based on my doctor, I wasn't supposed to be here today. Based on because based on statistics, what they do, and based on what they, assumption they have, this is basic. For me, this is an assumption because it's based on the form of treatment they provide, the system provides, not the doctors. I mean, the system provides. Based on protocol they provide, they basically do not include any other aspect of human being, like in terms of mindset, lifestyle, changing the diet, and doing many things like what you can do to support your body. It's just based on drugs, surgeries, and other things, right? Radiation and treatments. So based on that, they give people their life expectancy. So, and my question is always, is that the right statistic? Like, we're looking at the statistic, but those statistics are not based on so many different things. I mean, so many things. They're based just on a
Right.
small, like, I would say assumption. It's not even like a randomized studies. There's no randomized studies on people who have a BRCA and had a double mastectomy that their life are prolonged. There's no randomized studies because it's unethical to do such a study.
Yeah,
It's very,
there was nothing. Yeah, there was nothing else included with this other than, like I said, are you going to do what sort of therapies are you going to be put on afterwards or anything like that? It wasn't. It was just basically this. And I was really hesitant to bring this up about life expectancy because I think then it's going to mess with you. When people say, well, you
Yeah.
only got this long to live. Well, it gave you another good 5 years. Well, you know what? I'm going to
Yes,
live another
yes,
20 years. How about that?
yes,
And what are you going to tell,
yeah,
it's really, and as I think all three of us know, it's diet, lifestyle, and nutrition. I
yeah.
happen to be diagnosed with cancer. Okay, I'll play the game with you. So now I need to take some things and maybe look at some things a little bit differently because we do know about trauma. Trauma can trigger things because everybody is walking around with cancer within their
Mhm.
bodies anyway. So
Right.
what's triggering that? And really taking a deep dive about everything around you, traumas in the past, what are those things that are triggering, and Suzanne Silverstein has a great book, several great books out there too that even talks about that, where you know different cancers are related to certain traumas that you experienced in your past, and so far I have not found one that has been incorrect,
Yes,
which is just mind-boggling. So
yes.
um yeah, definitely a lot of things to look at. And I certainly want to add on here too is that, your mindset,
Yeah.
now you go into warrior mode, people, mind,
Yes.
body, and spirit, go into
Yes.
warrior mode because you don't let cancer define you. You are you, and
Yeah.
celebrate you and not what you get diagnosed with. Because and there are so many people out there that I think we don't do that. I mean, it's
Mhm.
traditional, right? Medicine
Yeah.
today. We don't
Hmm.
talk about that. Here, I'm going to write you a
No.
prescription. Here's this. Go.
Yeah.
And it's like, yeah, thanks, but no, I think there's more out there that I can do. I think there's more to me, and
Right.
and to be able to harness that and go forth and conquer,
Mhm.
mentally, spiritually, and find those, alternatives, which brings me to some alternatives. There
Yeah.
are alternatives to mastectomy.
Exactly, from different angles. So when people get diagnosed with gene mutations and they've been told by their doctors that they recommend them to do a double mastectomy. And if people choose to go with double mastectomy to prevent, no doctor would sit down and talk to them. Before we do a mastectomy, maybe you should look into another big picture of your life, where it comes your environment, your lifestyle, your dietary changes, your mindset, your stressors, your sun exposure, like, everything. Before we jump in and we can monitor you, on your BRCA, but go home and do this stuff first. Because if you have a mastectomy just to prevent the cancer, just because you have gene mutation and your lifestyle did not change,
Mm-hmm.
what makes you think that that the cancer is not going to develop? That they might not develop in your breast, but it might develop in other organ,
Mm-hmm.
right? Just because breast was
Right.
related to BRCA1 and 2, that doesn't mean the cancer, because I mean, like, if you have a gene, that's mean your exposure to cancer are higher
Mm-hmm. Mm-hmm.
than people who did not have, even though the statistic does show there's no difference between people who have a gene mutation or don't have a gene mutation, what risk they have in developing breast cancer. It's more of a, like, what lifestyle you
Mm-hmm.
have to develop that
Mm-hmm.
cancer. So, and the other part that I really want to touch and talk about, like, people who have implants, what risk they bring those implants in people's life. And that's another part that no one talks about it. And they do cause toxicity of the body. They develop mold in the body. They develop fungi, and and now FDA has a warning that people who have silicone implants, they might get large cell lymphoma, because lymph nodes, like, around, like, a implant, there's a lymph nodes that grows cancer, probably not to let, like, the stuff, like, the toxicity from implants to go outside of, outside that area, probably it develops some kind of, it's called, gosh, I made a note. Yeah, it calls like a large cell lymphoma. It's a BIALCL. So it's a rare but serious non-Hodgkin lymphoma that has been definitely linked to breast implants, particularly those with textured surface. So the question is, are you saving yourself by, having double mastectomy just because you have a gene mutation, or are you exposing yourself to more complex health conditions, down the road? So that's another question that, I would like to know. I would like to get the answer. Like how much are we really saving ourselves and preventing ourselves from not getting a breast cancer? Or this is another myth, not breast cancer or any other cancer. So, okay, people are saving themselves from developing breast cancer, but they can develop non-Hodgkin lymphoma, a rare form of non-Hodgkin lymphoma, because they're carrying a silicone in their body.
Okay, you're saying after they have a double mastectomy, that if they go implant-wise.
Yeah, if they go
implant-wise.
Yeah,
But there's other ways they don't have to do implants.
Yeah, they
Right?
don't have to do implants.
There's other options that they can do.
Well,
Right.
my question is like, is it all implants? Is it saline? Is it silicone? Is it the gummy bear? Is it all of them? They all have the same, risks, I guess, afterwards with the implant illness and prevention or possible other cancers coming about and all of that. It doesn't matter on the material, right?
Well, we're talking about, I think it's a silicone more, because I have read some FDA warns, like, because around the silicone, the body develops some sort of capsules that, those capsules are like, I don't know how the body that creates them. I think our body always works in a way to, keep us alive, basically, and it would do everything. So it creates certain capsules to prevent leakage probably from silicone or saline, whatever. I think that most people do have a silicone. So, and that develops into that large lymphoma, non-Hodgkin lymphoma. So, FDA does point that there is a direct correlation to that, from implants, because the level has increased in people with implants, that and we're not talking about other issues like people develop because I'm part of the group, like on Facebook group, and I do read people's stories. They develop such a incredible side effects, like fibromyalgia, fatigue, and all linked to tinnitus, ringing in the ears. Yeah, all linked to implants. And when people remove their implants, the problem goes away gradually. And other endocrine, problems. So the whole talk here is about do your homework before you agree to go for something, because there's so many ways out there that you can look at that preventative ways in prevent of cancer, whether it's generic or not generic, to prevent the cancer from occurring in the body. You just do your homework instead of jumping and just following the system that tells you this is the only way that you can, live your life, by removing your organs. Yeah. I would have, like, the thing I know right now, I would have doubted myself if I want to do it or not. Do you know what I'm saying? At that time, because doctor won't sit down with you, and my doctor did not sit down with me and said, okay, Ma, here's the thing, we offering this, but would be the outcomes. You might experience this, you might experience that, you might experience this. Then I would come home and I would think, like, do I really want to go through, through everything? And just like, okay, it's not doing mastectomy or not, I'm talking about having reconstructive surgeries or even having mastectomy. Do I really want to go through mastectomy? You know, is it really something that I want to do? Or can I keep my breast and you know, try other things at first and then see, you know, if that's something like, so what I'm saying is like, we have to prepare the questionnaire, you know, to ask our doctors every question that you want to ask. And when you get your answers and they are satisfying you, then go
Mm-hmm.
for, you know,
Mm-hmm.
then make your decision.
Well, I have to say that we had ours are almost what 12 years apart when you were
Mhm.
diagnosed and when I was
Right.
diagnosed, and different hospitals and that kind of thing. I have to say I was actually quite impressed with the team that came in. I had 7 doctors come in after my
Yeah.
initial diagnosis and come in and talk to me, and each one of them actually did come in. Even the surgical oncologist, she was like, this is what the plan is, this is what's going to happen. You're going to be numb, you're not going to feel anything, you're not going to afterwards. And I still don't. Sometimes really good when you got a 4-month-old puppy's jumping on you and they just happen to hit you on that side. It's like, wow, holy cow. But you know, didn't feel that. There's always, you know, bright side. But they did to a certain degree. I mean, they did. I mean, they did. And one thing that I think that is hugely important, you have options. You have to take a look at those. And they were, like I said, I was the one who was pushing for a double. I'm like, well, let's just take them both off. I don't need them. You know, why not? You know, if that's the case. And she was like, no, we don't need to do that. I was really pleasantly surprised to hear that they weren't gonna jump on the gun and do that. Now, the other thing though too is in hindsight and looking at everything, and I'm not a doctor, but I just think it makes me think, did I need to have it to begin with?
Yeah. No,
You know, what would have happened if I didn't? What if I didn't and I wanted to do alternative things? And those are all huge,
right,
incredible choices that we
right,
have to look into. Obviously, I
right.
didn't at the time, and yeah, so I opted for what I went through. And what I thought was interesting with what you said about with the implant was that I went right back into another implant.
Right. That's what I'm saying.
So
Maybe
why are we doing that? Or why not
right.
just we, but why is our medical system allowing that to happen?
Yes. It's not the
You know?
doctors who are bad. Look, I worked in
Yeah.
a chairman's office in a hospital, OBGYN
Mhm.
chairman's office. So I was
Yeah.
referred, I mean, because of the chairman, I was sent
Yeah.
to best doctors that were available when I was going through. So my
Yeah.
doctors were great. I have nothing against the doctors at all. My point is, they did tell me I might feel, I'm like, I will feel numbness, but no
Yeah.
one explains to you what that numbness is and to what extent are you feeling this numbness. You know,
Why?
it's
Yeah.
like you feel like your body is itching, but you have no idea what is it itching, and it drives you crazy because it's itching and you're trying to itch somewhere, like, and you cannot find that spot because
To
you
be
don't feel
discreet, there's
that.
no discretion.
I
It's
know,
just like,
and it's like you kind of you're trying to locate that spot because it's itching and you cannot locate because you don't feel anything, and that drives you nuts, that drives you crazy, and that happens every single day. You know,
yeah.
it's like, you know, I understand the doctors are great. They're just following the protocol, what they have to do.
And there's
As
the
I said,
protocol.
right, I was like recommended. I was around like a best doctors whom I like, you know, the doctors I
Yeah.
worked with, that, you know, I worked in the hospital, and the doctors I worked with, they sent me to best doctors in the field that they connected me with.
Yeah.
So
Yeah.
I want to say like I had like, you know, a very good care when they came from medical system, from medical team. Like they were very gentle, and the question is not about that. The question is that the system itself like does
Yeah.
not talk much about it.
It
That's
just
the
makes you
problem.
question, doesn't it?
Yes,
If
yes,
implants are so bad, why are they saying,
right.
oh, but we can do this afterwards? I'm like, well, I guess I'll see you again in what, 10 years? You
Yes,
know what I mean?
yes,
It just doesn't make sense.
yes.
But
That is so
yeah, it
true.
makes you
Yeah, that is so
wonder.
true. That's what makes me wonder. It's not about people. People are very gentle in medical system. I mean, I worked there myself for 19 years. You know, there I would not like be upset
Yes.
or mad at the patient. We did everything what we could to keep the patient, comfortable and everything, but our hands are tied. We cannot do more than because it's outside of the protocol. You cannot
Right.
do more
Yeah.
than that. This is the steps you gotta go through. And that's
Yeah.
and what the outside of the protocol is your job to do your research, to do your homework.
Yeah. Yeah.
Right, inside
Think
the protocol, they can tell you
absolutely.
what, outside is your job,
Exactly.
right?
Right.
So,
Mhm.
yeah,
It's true. I have to bring this up because I thought this was really interesting for anybody who is, wanting to look for the latest and greatest as far as whatever your decision is. But they do have a new technique for a mastectomy, and this is with the utswmed.org. You can look it up there. It's called robotic nipple-sparing mastectomy.
Hmm.
And this is rather than making incisions in the underwire, area below the breast, they use a single port robot to enter the breast from the armpit to remove tissue and reconstruct the breast, avoiding the nerve damage that results in desensitization. And it can preserve um, basically the full breast and the nipple if you're according to your doctor and your medical, if that is an option for you that's available. That's a new technique that they're using, and I'm thinking, wow, that's
right.
huge. It's
Mhm.
taken them this long to figure that out, but that's huge. I mean, it's
That is
huge.
huge. That is huge.
It really
Yeah,
is. So I thought that's just another, I just wanted to
yeah.
bring that up as far as the new technology. And I actually did have, it was a myth. Obviously, this is a myth. Question was, can your breasts regrow back? No.
Oh, that's an interesting,
Interesting, isn't
Yeah.
it? Yeah.
yeah, question.
Yeah. I was
Well,
like, oh, I go, that's a good one. And that's,
yeah.
and but I was like, no, they don't. They don't.
Well, if you look at the things like when we have a cut on our skin or
Mhm.
other part, we grow tissues to repair that, right?
Right.
So they're probably, and I think I have read and listened many years ago that people do regrow. Like, there's a scientist that they, showed how they could regrow like, half of the finger or whatever, you know. And with the technology we have a greatest technology. I mean, like, here in United States, there's a great technology. We have equipment, all kind of equipment, but we kind of trapped in the very, very bottom of the I would say on the bottom level of treating and approaching the diseases and conditions. It's more not it's more of a like I don't know. It's more of a like the robotic kind of system, repeating on
Hmm.
the same thing on everyone. We
Yeah.
yeah, we're not looking to individuals and their conditions and stages and the environment. We're not looking at any of those. I mean, the system, not we are. Yeah, I mean, I would say
Right.
the system is not looking at anything. They're just knowing like, okay, boom, this is it. This is a road I see, and that's the road you gotta go on, and that's it. There's no other roads around you. That's it. You know, and that's
Yeah.
I think like the challenge we have right now in the
Yeah.
medical system.
Yeah.
And
Yeah.
yeah, and we're talking about it not to tell people to do or not to do the things. We're just letting you know that do your legit homework, do
Mhm.
your research, and then make a decision after that if you really want to, follow whatever but at the time, so later in the life you won't regret it on the decision you made. Like by saying, oh, if I only knew that, I would have not done it. Okay. So before going there, do your homework.
Hmm. Hmm.
That's a really good point because I think sometimes we miss that. We get so overwhelmed with everything else that's been happening and going on and everything that everybody's telling us or we're reading online or we're getting from other people. And it's like you've been discussing this whole time, just taking your time. Like you have a little bit of time to be able to think through things, do your research, make the best decisions for yourself. And I think that that is just so huge. And we really need to push that. Understanding that you don't have to let anybody fearmonger you into anything. You don't have to let them push you into anything, and really do your research to be able to make sure that you are making the best decision for yourself. And I don't know if you guys did bring this up when I was trying to figure things out, but I was even thinking about the pain. I remember so many people talking about the pain and the chronic pain that they would deal with afterwards. And sometimes even like the numbness, that can be even painful.
Mhm.
And so, yeah, it's just a really good point to just do your
S-
research. What are you willing to
Yeah.
live with and what aren't you willing to live with?
Speaking of the
Yeah.
pain, by the way, I just I'm coming off cold right now. As you see, I'm talking through my nose. So past couple of days, when I get cold or flu or anything like that, the pain I experienced, the very first thing, it's like around this area. So I've been like experiencing all the time. It doesn't matter.
Oh,
Yeah, all the time. This is like where the implant is under my armpit. This is where I get like attacked more. Like I would feel discomfort. I cannot lay down on this side. I cannot, when I take a deep breath, I feel like, a lot of pain only around this area.
Mhm.
That's another thing. As soon as you get cold or discomfort or anything like that, that's for me, that's me. That's not like, not everyone might experience, but I do. So, but fortunately, I don't get sick that often. So maybe once every 3, 4 years. So that is
Yeah.
yeah. So I just want to say that, that's a pain, that's a discomfort. We have to learn how to live with it and continue living and, just, learning more from our experience in life, because I
Mhm.
definitely learned a lot from my experience from being diagnosed twice with cancer. I learned a lot. And I think I became a person who I am today because of that experience that had changed my entire life. Yeah. So we just wish for people not to go through that stages of cancer and learn their lesson, just learn before, you know.
Just remember
Yeah.
to breathe. Take a moment,
Yes.
breathe, relax, believe it or not, and always diet, lifestyle, nutrition.
Yes.
That's if you want preventative, that's key. And I
Right.
can't emphasize
Yeah.
that enough. But
And
you'd be
some,
surprised how
yeah.
many people don't really
Yeah.
realize that, and it's work. Yeah,
Yeah.
people, it's work. You might have to
It
make your
does
own
work.
food
Yeah. I'd say like
in
science.
our busy world.
Exactly. Science has proven like we can manipulate our genes. We can manipulate. Just because you have a gene mutation, that doesn't mean you cannot change your life and be happy and never develop like certain health conditions just because you have a gene mutation. Like we have so many gene mutations we don't even know, and we still live our lives, right?
yeah.
So we can manipulate genes by changing our lifestyle, by changing our mindset, by changing toxic environments, negative friendships,
Mhm.
just have to,
Mhm.
we just have to, you know, be more mindful, right?
Yep,
So, yeah,
absolutely. Good
yeah.
talk.
You
I
nailed it.
know.
You nailed
Good
it. It's
talk.
full of
Good
it.
talk, ladies. This
Yeah,
was good.
yeah,
I learned a lot.
we did it. Yeah, we learned a lot based on what the research we do. And no, we just want to share what we learned,
Mhm.
right? Yeah. Okay.
All
Um,
right. Until next week, huh?
yeah, we'll see you next Monday. We'll choose a topic to talk about next Monday, and we'll have another roundtable discussion. I really like our table discussions.
It's fun. You learn a lot. And just even listening to, I really wanted to actually just listen to both of you telling your stories and sharing your experiences because it's so impactful. It's powerful. And when you hear it from people that have actually gone through it, uh, I think it kind of sets with us a little bit more and sets with a little, it puts that humanity back into that humanity piece back into it. And so you just sit there and you kind of sit back and you're going like, wow, like these people are going through all this, or they've gone through all of it and they figured it out. And then, just wanting to be able to help people that have been in that situation or going through that situation so they don't have to go through it, without that
Mhm.
support. Because I mean, just listening to you guys discussing everything that you had gone through, it was like, wow,
Yeah.
wow.
Yeah. In
Yeah.
the past, people did have a mastectomies, before this, implants were invented. People did go through mastectomies and breast removals. Um, but it was very rare to do a whole breast, like, removing for lumpectomy. Like, right now, nowadays, like it's increased more than 25% past 10 years because of that. They added I mean, like a part of lumpectomy into the removing entire breast, and but they did not have breast reconstruction, stuff like that. I mean, in their mind,
Mhm.
probably in people's mind was, okay, they're saving their life,
Mhm.
and I'm okay with it. Like, to save my life, I'm okay with it because I think in the past, the doctors would remove the breast because it's a necessary at that time
Mhm.
solution. I think it was just removing the breast, and it was like the last thing we can do. It's removing your breast. Like, there's nothing else we can do about it. But nowadays it's like a little things. Okay, mastectomy. Little things is like bilateral mastectomy. Blah 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 blah. No, it's not. It should not be that way. We have to, be more like mindful. Like, for a female, the breasts are such a, it's their pride and joy, I would say, right?
Yeah.
It's
Yeah.
like, and here you go, like you have a disfigured figure, the body at this point, and you have to learn how to live with it,
Mhm.
right? You have to learn how to live with it on a daily life. When you're at older age, I think you might not care as much as the younger people do. But I was 44,
Mhm.
when I had mastectomy. So at that age, like, I didn't want to have a body that what I had, for example. But again, we learn how to live with it. We learn how to accept it, and we learn that it's a lot comes with mastectomies for a female. That's why we're talking about it for people, just to bring the awareness, like what we went through. And as if you can avoid it, avoid as much as, like, possible. But do your homework, do your, like, talk to your doctor. If you cannot hear the, answers to your questions, find a doctor who's going to give you those answers, and work with that doctor. Be comfortable with what you're doing, and not to be kind of regretful later down the road that what you did was wrong.
And that's
Yep.
big. That's a good place to
Yeah.
end. Yeah.
Yeah.
Just thinking about for sure what your choices you're making. Are you okay with living them for the rest of your life?
Right. Okay.
All
So we'll see.
right.